Oh, hi there, this is Dr. Evan Osar with Integrative Movement Insider. Welcome to this edition of Integrative Movement Insider. Happy Monday. Hope your weekend has started off, or I should say, hope your week has started off well and you had a great weekend and enjoyed that extra hour of sleep if you're here in the United States and you're in one of the areas that changes their clocks and sets them back. Welcome to this edition of Integrative Movement Insider, where we're discussing a very important topic as it relates to your older clients that have shoulder issues. Many of us have been taught, myself included, that we need to strengthen our older clients' rotator cuff muscles. Now, I was thinking about this as I'm preparing for a workshop, a virtual workshop that Jenice, my wife, and I are doing this weekend with our friends, Dr. Dan Ritchie of the Functional Aging Institute, for DCAC around this topic of training the older adults. Hello, my good friend, Debbie Prusecki. She's one of my nearest and dearest friends. How are you? My friend Jackie Bachmeyer is on as well. Hello, my friend. I'll see you soon. So, I was thinking about this topic about the rotator cuff and the topic about strengthening the rotator cuff. How do you know when the rotator cuff is strong enough? Because we've been told by people like me, right? Physical therapists, chiropractors, rehab specialists, doctors. Oh, you need to strengthen your rotator cuff, your client's rotator cuff, to help them with shoulder pain or tightness, or to help them prevent shoulder tightness and pain. Well, then how do you know when the rotator cuff is strong enough? And can the rotator cuff get too strong or too tight and actually inhibit optimal motion and function of the shoulder complex? Well, one of the things that I'm writing about in my brand new book, Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction, part 2, I should say, edition 2, volume 2, is about the rotator cuff. And first, let's understand briefly what the function of the rotator cuff muscles are. There are 4 plus an additional 1/5 muscle, which is the biceps brachii. So we have the supraspinatus up here. We have the infraspinatus back here on the shoulder blade, the scapula. We have the teres minor on the edge of the scapula. And then we have the subscapularis, which is inside your armpit there, inside the inner border or inner surface of the scapula. What these muscles really do, their function, their primary function, yes, they can rotate the humerus, and that's an important function. So they rotate the ball in the socket, or upon the socket. Their primary function is their feed forward stabilization muscles. And that's just a fancy term to me. Their job is to contract prior to movement, feed forward. They feed forward into movement so that the glenohumeral joint, that ball and socket joint, are stable when you do other movements, like lift your arm overhead and or push and or pull. Now, when we think about the rotator cuff muscles, and we have been told by our therapists or chiropractors or rehab specialists to strengthen the rotator cuff, do we actually know if it's doing what we intended to do? Here's a much better way to determine if your rotator cuff exercises are actually doing what you think they need to be doing, or you think that they are doing. Let's use range of motion, because range of motion is really your nervous system's sort of snapshot, or a snapshot into your nervous system, how your exercise is impacting your client's nervous system. Let me give you an example of that. So you can do this with me, or do this after you watch this video. Put your arm up into 90-90 position, so right here. So obviously we have external rotation, which should be somewhere around 90 degrees, which would be right here, and maybe a little bit further. I've got a little bit further range of motion, about 100 degrees. Now, what's more important, or I should say as important, is the internal rotation range of motion. So you want to monitor your client's shoulder to make sure that they're getting pure internal rotation. So for me, I have about 30 degrees of internal rotation. If this is 0, that's about 30 degrees of internal rotation. It's a little limited on this left side. However, most of your older clients, if they have 30 degrees of internal rotation, they're pretty good. So if they have 90 degrees of external, 30 degrees of internal, they're pretty good with their shoulder. What happens is when they start to tighten their external rotators like they've been taught to do. Hello, my friend Sue Gleason, my fellow Chicago friend and integrative movement specialist to be. She's in our program right right now learning about the shoulder and shoulder exercises. So let's do what we've been seen in physical therapy, been taught in physical therapy, and in all these rehab classes for the shoulder. Chest up, squeeze down and back, pin the shoulder or the elbow into the side, and I'm just gonna do 10 external rotation repetitions. Okay, so very common exercise, decent amount of resistance, not too much. So here I am doing 10 external rotation ranges or repetitions, okay? I think it was 10, it's somewhere around 10. Now, let's go back and see what impact that had upon my shoulder range of motion. So let's go back to our 90-90 position. Let's go external rotation. So I probably gained a couple degrees of external rotation. Now, let's check internal rotation. However, I lost a lot of internal rotation just by one set of doing external rotation work. When I first went to rehab for my shoulder injuries, I had shoulder impingement. That's how it starts out quite frequently. Shoulder impingement with overhead motion. I was taught to do lots of stretching of my pecs and internal rotators and lots of strengthening of my external rotators. No one taught me about the importance of internal shoulder range of motion, internal rotation. I lost internal rotation because of all the strengthening of my external rotators and all this stretching of my internal rotators. Well, when you lose internal rotation, you will compensate. You will compensate by going this direction. You'll start bringing the scapula up and over your rib cage, and you'll start throwing the shoulder forward. Well, what does the physical therapist then tell me to do? Squeeze down and back even more. Well, I can't get my shoulder forward, so what do when I've lost external rotation, or I should say internal rotation? I will throw my shoulder forward. So you may be saying, well, Dr. Osar, what do you need internal rotation for? Every single thing, virtually every single thing you do in everyday life. The keyboard is internal rotation. Feeding your face is internal rotation. Doing anything out here, manipulating anything out here in space is internal rotation. And when your clients lose internal rotation, they will throw their shoulders forward to make that happen. And then you and I, in our infinite wisdom, or the education we've all learned, tell our clients to do what? You don't want your shoulders out here. Squeeze them down and back. And then they lose the ability to have internal rotation and get their arms to easily come out forward, so they'll throw their shoulders forward to make it happen, to work on their phones, their computers, and do all the manipulation of things out in front of their body. So that's why understanding functional anatomy, which drives me crazy, maybe it drives you crazy as well, when these people in our industry say, you don't need to know functional anatomy, just go train people. No, you need to understand functional anatomy. You need to understand some biomechanics and motor control to make sure that your exercises are most appropriate for your individual client. In fact, I was just talking to my friend yesterday who's in physical therapy, and she's in pulmonary therapy, and she said to me, yeah, the physical therapist that's teaching this program is awesome. He's an awesome guy. He's got an awesome program around pulmonary rehab, but his exercises aren't so great. He doesn't even pay attention to any of my form when I'm doing my exercises. So she pays attention to her trainer, Sarah Fisher, who's part of our clinic right here, uses that form as well. So what do you do with your clients that maybe need to enhance the function of their rotator cuff and also improve internal rotation? Well, one of the easiest things you can do, one of the patterns we teach our clients, we generally teach them this in the lying position or supine position. You can do it with their back up to the wall if your client cannot lie down, as we do band pull apart. The great thing about the band pull apart is it helps you to activate the rotator cuff, but not excessively use it, and especially external rotation. It also helps to teach the client where the shoulders should be, the scapula should be relative to their thorax. Because the best way to train your rotator cuff is actually to train the scapula properly upon the rib cage. And again, there's probably some people out there saying, well, Dr. Osar, how do you know where the optimal position is? We know that there's a more optimal position and a less optimal position. In fact, if you actually go read the research, you will actually see that people that have impingement syndrome tend to have more anterior tilted scapula and downwardly rotated scapula. People that have chronic neck issues will tend to have issues with their scapula and scapular control, the motor control of their scapula. So there's lots of research coming out now to discuss the importance of the position of the scapula, and that there is a more optimal, maybe there's not the most optimal for every single person, but there's a more optimal position and there's a less optimal position for your scapula, which will also help and support your rotator cuff. All right, so here we go. Take your band, keep a nice wide shoulder position. You may need to do soft tissue release on your clients, but let's just look at my range of motion again. Again, loss of range of motion here, and I've also lost some flexion by that not great rotator cuff exercise. So grab your band, pull apart gently, bring it to your shoulders, to your clavicles. So from the side, it looks like this. I'm gonna breathe in, I'm gonna keep space in between my arm and my body. I'm gonna breathe in, and as I breathe out, arms come up. So I'm teaching the rotator cuff how to maintain glenohumeral stability, or control, I should say, more control and stability. And I'm also teaching the shoulder or the humerus how to move independent of the scapula, which is what you lose when you create too much tightness in your rotator cuff. So here's what it looks like from the front. From the side is breathe in, breathe out. From the back, long spine, wide shoulders, breathe in, breathe out. Again, move slow. Coordinate your movement or the client's movement with their breath, because the breath and the shoulder stability or shoulder stability go hand in hand. If your client's not breathing well, their shoulders aren't going to be healthy. Bottom line, if they're not breathing well, their shoulders will not be healthy. Their head, their neck will not be healthy. Breathe in, breathe out, and relax. Now, I would probably do 2 to 3 sets of that, but let's just go back and see, did that impact my range of motion at all? So let's look at flexion. It actually increased my flexion, and it also increased my internal rotation. So you're saying, Dr. Osar, you didn't do any internal rotation. And that's exactly the point. When you teach the rotator cuff to control the humeral head in the right position, the right scapular position, the most optimal scapular position, the most optimal position of the head, neck, and rib cage, you teach the nervous system to how to start to use these muscles in a more optimal manner. The nervous system will respond kindly and give your client range of motion. So that's why it's so important that you pay attention to your client's alignment. You pay attention to your client's breathing. You pay attention to your client's motor control, especially when you're dealing with those older clients that have chronic tightness, discomfort, and maybe they have rotator cuff issues as well. This is Dr. Evan Osar. I hope you enjoyed this video. I hope it made sense. If you're looking for more information, I've got a 2-hour session this Saturday with my friends at DCAC. I'm going to be joined by my wife, Jenice Mattek. She's going to be talking about breathing and the position of the rib cage, because that will feed in very nicely with what I'm going to share with the rotator cuff and how to improve shoulder function and enhance shoulder mobility as well as stability. Our friend, Dr. Dan Ritchie from the Functional Aging Institute, he'll be on. Hello, Mark, how are you, sir? He'll be on with us as well. He's got 2 sessions as well. Group training for the older client as well as balance training for the older client. So these 4 sessions pair nicely if you work with older clients. Hello, Karen B. Wells. Good to see you. So these 4 sessions pair very nicely. It's a virtual setting, or I should say it's virtual. It's online. It's this Saturday. CEC's from AFA as well as I believe NASM, but the information is below or next to this video, and the link to enroll is next to this video or below this video, wherever you're watching it. We look forward to seeing you. We'd love to have you as part of this mini convention with DCAC. Rahul, my friend from India, how are you? And you'll leave with strategies, just like I shared here. Hopefully you've tried this, or you've seen this, or you'll use this later. Try it for yourself. See the differences in your own shoulder before you start working with your clients, and then try it with some of your clients and see if you notice some of the same results. So you assess your client, you use your corrective exercises to help create a more optimal strategy, and then you integrate this, because you have to integrate this idea, these concepts, into the functional pushing, pulling, and carrying patterns. And we'll show you how to do that this Saturday. So the link is next to this video, below, somewhere by this video. We look forward to seeing you this Saturday. It's 9 or 8 a.m. Eastern Time to somewhere around 2 to 3 p.m. Eastern Time. Again, we're just 4 sessions, bam, 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 And then you get your CCs, and more importantly, strategies that will help your older clients perform at their best, so that way you can be the specialist for your current clients and attract more older clients that really need you, that really want you, and will pay you for your expertise. Make it a great day. Get out there, serve your clients, be the leader for your communities, bring people together, and we look forward to seeing you next time. If you have any questions on this video, put them next to this video, and I'll check them out later and get back to you. Make it a great day. Dr. Evan Osar with Fitness Education Seminars and Integrative Movement Institute. Take care, guys.